Okay.
And if you want me to, if you're having trouble, you can email it to me really quick and I can share it that way, and just advance the slides through. I don't know that it shared. If you want to try one more time.
Okay. All right. Let me try because I'm hitting and it's doing cancel. Maybe I did it too soon.
Yeah, it might have been because I still maybe had mine up. There, now it's coming up.
Yes. Okay.
Yeah, it must have been that
Oh, maybe I just did it too soon. Okay, great. So, let me make this bigger. Maybe you can see it better. Okay. So I wanted to start. I just wanted to tell you something about the New York Statewide Breastfeeding Coalition. So, so thank you first, Sarah, for that introduction. Sarah and I met at the U.S. Breastfeeding Committee meeting during a fire. I guess it wasn't even a fire drill. We were outside during the fire. Anyway, so thank you for inviting me. Yeah, so our coalition is what we call a coalition of coalitions. And so our representatives are all from various coalitions. We have a fair number of regional, county, and city breastfeeding coalitions in New York. You know, we're a big state. And we also have representatives from the major, maternal child health organizations, the midwives, perinatal networks, the Leleshi League. We have various coalitions representing individuals of different races, orientations. And we also have people from the state and city health department and the WIC program. So I'm the representative from the New York State to the Breastfeeding Coalition. So I've been involved with the group for about probably 15 years. And so, the coalition has been involved in, proposing, supporting, advocating for various legislation. Their role does vary by the legislation. It's important if you are working on legislation to realize it takes a long time. In New York, we have 2-year cycles, and we have bills that have been introduced, every 2 years for the past 10 years. So they don't always advance. So the coalition and all our various members and their roles can meet with officials and legislators, talk about shared interests. At least in New York, they're very interested if something's happening in another state. And, it's very easy for a legislator to propose legislation if there's a model in another state that they can take or rectify. And that's always part of what we're doing. Also in my state role, we do that also. When there's legislation going forward, we have to find out everything that's other states have done. But the coalition also can meet with New York State leaders all the way up to the commissioner. And also in the governor's office, there's a health person who reports to the governor. They also can meet with Medicaid officials, and we've been involved in changing our Medicaid rules. And then they join with advocates, partners, and stakeholders. And, we really saw that in efforts to get New York State paid family leave. That law passed. That was a lot of work and a lot of people. Breastfeeding Coalition was involved, but, AARP was involved. A number of the unions were involved. All the medical public health associations were involved. It took a lot of people, and it also took, some very strong advocates. And, one of the things people may know, this happened during our former Governor Cuomo's term when he was in office. His father got quite sick and died during that time period. And afterwards he said, "I wish I had spent more time with my father." And that kind of resonated with him. And so, he ended up being very supportive of the legislation. The other thing the the coalition does is we hold conferences, and we can purposefully select speakers if we're trying to advocate for certain things. And I just wanted to go through, and I'll send you this when I'm finished, is the laws, regulations, and policies that we have in New York. I've been here almost 20 years and have worked on most of these, many of these in different capacities. And then I will kind of end with our New York State, the recent, it's now nursing employees in the workforce. But one of the first laws before my time in New York was we had the first civil rights law, which, allowing it's mothers, but people to breastfeed in a public place, and that was in '94. 10 years earlier, we had a law excluding breastfeeding of infants from exposure offenses. One thing that may have that's unique in New York is under public health law, there are what's called, we have perinatal regulations, and they give the commissioner certain rights. And so like laws have to be developed by the legislature. We have an assembly, a senate, and then they have to approve, and then the governor has to sign off. But a lot of laws then require regulations, and the regulations under health, then the health commissioner can change those. There's a whole process they have to go through with a public health planning council, whatever, but there's a process that we can change regulations that are under, that are required under legislation without having to go back to the legislature, because it's very hard to go back to the legislature and get them to change something. So we have that law that gives the commissioner the right to do some things. And that's in health. And some of these other laws that we have been able to affect, they're in other departments, and they have other commissioners. And that's like labor law. That's in the Department of Labor. We have another law in public health law, and it requires the hospitals to report this with what we call this maternity information leaflet, and it comes out annually, and it has all data at each hospital, and it will include for maternity information, like what percent of births are C-sections, what percent use anesthesia, what percent use forceps. And so we were able to do two things. One, we added breastfeeding measures to that. So now we have a annual report for each hospital, what percent of infants are breastfed and what percent of infants are exclusively breastfed. We exclude babies admitted to the NICU and babies who are transferred into that hospital. So we were able to change that. And of course, there's a whole process. We had to change our birth certificates in the state and then the city and go through training processes and a lot of different things to have that happen. But now the hospitals, when someone is admitted or pre-booked, as the term that's used in the legislation, they have to be given this brochure or this maternity information leaflet, and it lists all that information from the hospital for the past year. There's also other information in there about, SIDS and shaken baby and a variety of things. That information then is also, we have something called New York State Hospital Profiles. So you can go and find each hospital, and for maternity information, you can find all that information I just, listed. There's probably about 30 things that are listed for maternity, but it also includes these two: fed any breast milk and fed exclusively breast milk, what percent. And if you click around here, you can see it ranks all the hospitals in the state and where they are. So that was a big deal, to make hospitals more aware of their numbers and how they ranked, and the public aware of that. We have another law. It's called the Breastfeeding Mother's Bill of Rights. It has been amended several times to include our worksite laws and also childcare. And it gives, it still says mothers. We're need to work with the legislator to change it to be more inclusive, but we have to work with them to do that. But it states the rights of mothers or parents to certain, breastfeeding education and rooming in, and it has many of the 10 steps, with the exception of the code of our hospitals are not required to purchase formula, but many of the other 10 steps are in there. And this has to be a paper or a pamphlet describing all this has to be given to people when they are admitted, and it also has to be posted in each birthing facility. And because people have the right to breastfeed in childcare centers and work sites, it also has to be posted in the childcare centers. So I gave you the links to those. We have laws requiring health insurers cover infant feeding education and lactation counseling. We have a law requiring that a mother who is nursing can have her child with her up to 1 year in a correction facility to care for that child and to breastfeed that child. There, may be some exceptions, but for the most part, that happens. We have a law giving people who are breastfeeding, they can delay their jury duty up for 2 years. We have a law, there's a federal law requiring lactation rooms in federal buildings. We have a similar one requiring lactation rooms in New York State public buildings. People may know there's the friendly airports law requiring lactation in certain airports. It's based on the number of landings and hub size. So it's the big airports, the really big ones, and then they amended it and included other airports. And then New York added a law that covers the other airports that aren't in there. So it's very interesting writing this. I knew nothing about the number of landings and the size of the hubs. And of course, during COVID, all this went down and the numbers got impacted. So this is the law I think that Sarah wanted me to particularly address. So in 2007, we passed labor law, and it was very simple. It's like one sentence long, and it stated that employers must allow breastfeeding mothers, reasonable unpaid break times to express milk and make reasonable attempts to provide a private location for her to do so. And it also prohibited discrimination against breastfeeding mothers. But the law was very little. And over time, we worked with the Department of Labor. We did webinars that we distributed widely. And our webinars or webcasts, usually we try to get continuing medical education, nursing education, lactation education, public health education, to encourage people to watch those. And then, when we had complaints, whatever, we went back to the Department of Labor, so they knew what people were hearing. And over time, they developed a set of, recommendations, but they weren't in law. And we fund community contractors. We have CDC funding and we have some state funding. And those community contractors, they would work with work sites and try, we always try to get them to have a policy, but the policies that the lawyers at the different businesses, they didn't want to write anything in the policy that wasn't in law. So, we realized how important it was that the law needed to have more information. And so through a combination, again, we fund these community coalitions, and they would be talking to legislatures, and we were, and labor, this bill, Senate bill, there's a number, I give you the link. It's now called Expressing Breast Milk in the Workplace. And I have it here, was passed. And this is just, I'll give you this, and it just goes, this is the Department of Labor, again, another department, and it was effective June 7th. and it requires employers, again, have a private space, nearby running water, can't be a bathroom. So it has more requirements. But the really important thing for us is that it requires a policy in the rights of employees to express breast milk in the workplace. And we always have to produce everything in multiple languages for the public. And I have that here. And so this, is the policy, and the official policy. In this policy applies to all employers, public and private, if they have one employee, and it's pretty specific. It's unpaid break time. They can use paid break time if they have it, or meal time. The time has to be provided up to 3 years following childbirth. The employers must provide on break time at least every 3 hours if requested by the employee. Employers cannot discriminate in any way if an employee decides to express breast milk. And if the workplace is has hours that are available, then the employee has to be permitted to work before or after their normal shift. Like where I work, people work 7 a.m. to 6 p.m. So no, so if you, a lot of people come in at 9 and leave at 5, but so you can see there's a fair amount of flexibility in there. So a lot of people, they just, their day will be longer, but they don't have to use unpaid time. And we have, there's additional information here. And then, the breaks have to be at least 20 minutes, less people have to walk off a fair amount. And then, employees are, required to make a request that they're going to, express breast milk, and they ahead so they can work out the schedule. We have requirements for the lactation room, and they're pretty specific. They, don't have to have running water, but should be nearby. So this is, pretty much what we would have liked. And then there also is a requirement that this policy be given to all employees initially, annually, and then at the time they return from leave after taking taking leave for childbirth. So and because it is employees, this will be for both parents, that they'll have to be given a copy of this law. So, and there's also information on the Department of Labor's website, how to file complaints. And, a lot of times we have what's called a listserv. It's, your breastfeeding listserv, and we'll get complaints. And we always, go back to whoever complained and encourage them to file a complaint with Department of Labor, whoever or whatever the issue was. So so far we haven't heard any complaints. We've heard lots of questions from employers, and it took effect in June, but we have 2 months, I guess for them to actually be required to be implementing. So they should be implementing now because we're into August and the policy should be coming out. And I'll just say something about one other law. This is our New York State paid leave. It was passed in 2016, went into effect January 1, 2018. It started at 8 weeks, 50% what they call the average weekly wage. It's based on the past 8 weeks, and over 4 years went up to 12 weeks at 2/3. It is capped at what's called the state average weekly wage and can be used for a number of things, bonding with a newborn, newly adopted or foster child, within 1 year of the birth, has both parents, and also to care for a close relative with serious illness, and then certain exigencies associated with military deployment abroad by a close relative. So this, again, because it covered these 3 things, all those advocacy groups worked on that. New York also was one of the states that has what's called temporary short-term disability. This can be up to a total of 26 weeks, but, with physician notice. But for pregnancy, you don't need any additional physician notice, just that you're pregnant. It can be used 2 weeks before the due date and either 6 to 8 weeks after the due date. And so this leave can be used, then followed by the New York State paid family leave. So that would give our new birth parents 12 plus 8 would give them 20 weeks that they could take paid leave. This is another law that our legislature does. They pass a law and they require the health department to, do a review and a report on racial ethnic disparities, and then send the report to the governor and legislature. So this ends up being an opportunity for then the health department to tell the legislature, these are additional laws for breastfeeding that we think you should do or could do that would, this was to reduce disparities. So our legislature often does this for all kinds of things. But so we are actually happy that they did this. And this is a response to some reports that we do have disparities in breastfeeding in New York. And these are just some resources. So I happy to take questions or expand on anything that I talked about. And like I said, I will send this because it does have the links. Now, stop sharing.
I just had a question, Barbara. I think these is great examples of legislation, but I wonder, has it really affected your breastfeeding rates in New York? I mean, do y'all see that the rates have gone up since these legislation has been in effect?
Yes, I don't have them ready to bring up, but yes, we've seen a steady decrease in our any breastfeeding. That's really what's and also a decrease in the disparities in any breastfeeding. We did see with COVID, like our WIC, we had a 5% decrease. And then we have data like from PRAMS, and we saw decreases there, and the decreases were greater among Hispanics and non-Hispanic Blacks. And we also saw greater decreases outside the city. We have seen increases in our exclusive breastfeeding rates. The disparities have persisted. They haven't reduced as much, but we've had pretty dramatic increase over the years. And how much all this contributed, I don't know. We had this legislation, in I think 2008. There was ERA funding, and both New York State and New York City got, 5-year grants to focus on breastfeeding in hospitals with quality improvements. And out of those is what led to, the CDC funding its initiatives in hospitals, because we work with Charlie Homer, and then Charlie Homer then worked on the CDC program. So we put those together. So we saw a big improvement, because we were specifically working on hospitals. 2008, we did it for 5 years, and then we got some additional state funding. And the city has continued some of those efforts, to increase the number of hospitals that are baby friendly in New York. So, we've seen those, and I published some papers looking at policies in hospitals, and during the time period we saw an improvement in the 10 steps, but then we broke it down further in hospitals. And I mean, we just have done so many different things. It's hard to know what those are. Like, I mean, as far as the perinatal regs, that's how we got rid of the hospital discharge bags. We had to put it in the regs, and then we put in requirements about rooming in. And again, we've tried to change as many things as we could within the regulations, because we know all our hospitals aren't baby friendly. We have about a third that are now. Our numbers of we used to have 146 maternity hospitals. I think we're down to 121, something like, the numbers have been decreasing. We changed our requirement from vitamin K. It used to be 1 hour to 6 hours. That was another reg change that we did. So we've looked at like all the things that are, interfering with breastfeeding, or we're not getting support, and, where we can try to, change regs, we work on those, the health department, and then those that we need legislation, that's where we need, we certainly need the Breastfeeding Coalition and all the advocates. I mean, right now our perinatal regs are being changed. This started before COVID. It's a big process. It's not just breastfeeding. It's how, we have probably most states, we have regional perinatal centers, and they oversee the, level 1, 2, and 3 hospitals, and we reassigned in New York, and they're changing all the requirements and things. So, some of that is, there are requirements for lactation support. So we work on those. So we have seen improvements. I mean, I think for the most part, we're somewhat, better than most states, higher rates. But, we still have, significant disparities. And we have a lot of formula supplementation of breastfed babies. And that's a big problem for New York. We're not, we have, part of it is certain populations, they believe you need both, you probably hear this, right? Breast milk and formula, and it's, it takes a long time to change. We're hoping the work site, we've had the laws in the work site before, but this, now that it's clear, it applies to everyone, private and public. And, there was a fair amount of attention initially that, because we think the big places, they all have nice lactation rooms, and, Google and Salesforce and all these nice places. But, particularly our small, mini malls, the McDonald's, I mean, all those kinds of places is trying to make sure that they have that too, and changing the mindset. And, we're fortunate, I don't know if whether your state has it, the CDC SPAN grant, we're focusing on, we support a number of our community breastfeeding coalitions, and they're actually working with work sites. And we have some state money that goes into that. So, that's going to be a big effort now, particularly, trying to reach the smaller employers and low income employers. And, again, trying to get people to change a mindset. We did see with paid family leave, and we did publish a paper. We saw we had the lowest breastfeeding rates for non-Hispanic Black women, and we saw like significant increases in initiation, and then we used PRAMS data, so we followed out to 8 weeks, and all those increased significantly among non-Hispanic Black women. And in our data, that had the most, because we had, they were 10% lower for initiation. If you don't start breastfeeding in the hospital, you're probably not going to continue.
Yeah.
So that's
great.
That's a big effort. But I mean, then the COVID came, and we saw reductions, and everyone, some people were saying, oh, we thought people would have higher breastfeeding rates because they were home. But as you all know, we had like no lactation support in the hospitals, none, just virtual when people went home. People were stressed. They had all these other children home with them. I mean, it was not relaxing. So it's not surprising that it fell off, and it fell off both in our WIC data, our PRAMS data, and we have and our hospital data. So those are our data sources. So and I don't know, fell off 5, and the last I saw was only back up like 1.7% in our WIC. And we have a delay in our data, but it takes a long time to get back. So
I think, and correct me if I'm wrong, anybody, I think we have a 17% difference in our state. Is that correct? With between white and non-Hispanic Black families breastfeeding, which, it's when we think about addressing breastfeeding, we always think about legislation that addresses just breastfeeding, right? It has the title of breastfeeding in there. But what your research showed is that addressing parental leave, and yeah, not in maybe in COVID time, but parental leave with all those other supports in place is what can make a huge difference in breastfeeding rates. Because, I'm sure all worked and known moms who are going back to work at 2 weeks, or they don't ever start because they may have a limited amount of time with their children, and if they're new infant and they already have children and they know they have to get back to work soon. And so it just doesn't even seem perhaps worth it to start,
Right. And that's in the literature. And then for this breastfeeding disparities report, we gave the School of Public Health a contract, and they did key informant interviews, and they did surveys with people. And those are things people were saying, that they, these are mostly with people who worked with, clients in our communities and geographic areas that had lower breastfeeding rates, that people just wouldn't start because they knew they had to go back to work in 2 weeks. But then people did talk about, the paid family leave making a difference. So, so that's kind of a mindset to get people to change. But what we've seen, like our study when we reported, was just in the first year of paid family leave in 2018. The Department of Labor, and actually it's kind of funny, Department of Financial Services, because our paid family leave is run through an insurance program tied into employers have to pay. It's complicated. They collect money, and then it's through an insurance program that paid family leave is paid. And then but anyway, so the Department of Financial Services oversees these insurers. So because I worked on the legislation and I got to work with them, and we put all these measures in, and they have to report data. But they've seen, since over the 4 years it's gone up, the percent reimbursement has gone up, is that, participation has gone up, and they've seen a significant increase in the percent of second parents and in the length of time. Because initially, it's mostly fathers. They were taking 2 weeks or less, and now they're taking more time, and the percentage is taking higher. So that's a mindset too, for I don't know. I have my daughter. I don't remember how long my husband was home. It wasn't very long, but I'm seeing with my nephews and my son-in-law and whatever. I mean, they're taking their full paid family leave, and we're seeing that at the state levels. So that's another thing too, because it's, yes, maybe only the birth parent is, breastfeeding, but still, they're a lot more successful if their, partner or husband or spouse or whatever is supportive, and also, home and available to do other things like watch kids, go shopping, right? All that other stuff. I mean, they show that that's increases support. And it's just, I don't know, I'm a relatively new grandparent, and it's hard. Breastfeeding is hard. I mean, and people are going to have challenges, and they're at certain predictable times, maybe, and when they come home and they go back to work and all that kind of stuff. But if you have more resources, and again, one of the beauty of our paid family leave is because parents can take it in the first year. The parents don't have to take it together. They can stagger it. And that, really helps a lot of people. So like going back to work, that can be like a transition, not just nothing to all day back, because, as many of you know, a lot of babies, they're not gonna go from nursing to a bottle. So you're gonna have that kind of difficult transition there. And if, and as work sites become more flexible, allowing either having childcare on site or nearby, and parents can go breastfeed that baby as opposed to, just be pumping at work. So, yeah. So I think it all contributes, and also I think it normalizes, because, even though we have all these laws and whatever, and I'm really excited that the employers are going to have to give this policy out, but a lot of people, parents learn from other colleagues, what somebody else did or something, and that's, we have various places that I work is like support groups, or just because, there's like how the logistics and things. So, I think as breastfeeding becomes more normalized and more, going back to work and, making it work, people will nurse longer. So,
I have a bunch of questions, but would somebody else like to ask some questions? I always have questions. So I don't want to monopolize, the questions. One of the things that I was going to talk more about this, getting the policy into the human resources. Do you know of that being a policy in any other state, or was that something that New York pioneered? Because, it's fine for that policy, for the policy to be there, but I feel like human resources departments don't really know about it. I know, no job that I've ever gotten have I ever had in my introductory packet, let alone in my in yearly, has addressed breastfeeding lactation rights or legislation. And so is New York State the only place that you know of that's doing that, or is that pretty common in the US?
Yeah, I think that New York is the first. I mean, we've been in touch with CDC and whatever, and they're very interested, but I believe it's the first that actually requires a policy, and the Department of Labor, is requiring that, this specific policy is what you have to give out.
Mm-hmm.
Like in our perinatal regs, we require the hospitals have a breastfeeding policy, and then they have to give a breastfeeding policy. And then we say it must address this, but, we don't give, we did a whole thing with a model policy, but we didn't tell them they had to do that policy. And as part of a graduate school project, I've had a couple of students over years, get those policies and examine them. And it's, oh my goodness, the policies are all, multiple documents, and it doesn't include all the components. So, when you let somebody, there's advantages and disadvantages, I guess, right? You let the hospitals tailor it, but then they don't really have the components they're supposed to. And with Department of Labor, they just said, well, nope, this is our policy and you have to give it out. And here's like, the policy in 20 languages or something, so you can do that. So I think we're the first. And, and like I said, what they're doing is requiring this specific policy has to be given out. So
we have our state breastfeeding. We have a couple of state breastfeeding laws. One is public, that you can breastfeed in public, and the other one is that we actually, South Carolina passed a law for allowing milk expression, or for mandating milk expression not mandating it, I'm saying it all wrong. For, telling employers they have to let their pumping parents or their expressing parents express in the workplace. So that law was actually passed before the Pump Act. It was passed in what? Does anybody know? Was that 2018, 2017? Does anybody remember when that law was passed? No. I can't remember when it was passed, but it wasn't too long ago. And so when you added your human resources component, you just it wasn't a whole new law, right? It was like an amendment onto that law. It was piggybacked onto that law. Is that right? Your employee law?
Right, because we had labor law, what was it 206? Yeah, so they then amended the existing law. I think the link I'm giving you might actually have the actual, the first law and then the new one where it's all like in green or something. It's in a different color. Yeah, so that's, and usually it's easier to amend a law than to go with a new law. That one document that I gave you, I'm just looking to see whether it lists has every state. It's not always 100% perfect, but it should have. South Carolina. Yeah, so you've got, I have this up right now.
It's on our website. I just can't remember.
Yeah. So you have, yes, South Carolina Code 41-1-130 2020 Lactation Support Act. Yeah, shall provide employers with reasonable unpaid break time daily and shall permit employers to use paid break time, meal time. Yeah. So yeah, you have that. So you could then try, if you find out because that's what we do. You find out the legislator who who sponsored it, who was supportive, and you go talk to them and you say, wow, look what New York did, or some other state if you want. And, say, well, maybe, we could do this here. And, for what we find for our legislators, I mean, we're often going, California's, they do a lot of things that we like, and suggest that they might try that or something. I mean, some New York people like to be first, but, for them to take, well, look, here's this law, it's all written, and we will, propose it in your state. So you could certainly, suggest that. And whoever sponsored this law originally, if you go back, you can see, and you'll see who opposed it too, because you have your sponsors and then who votes for it. And then some people may oppose it. Some people may just not vote for it. And then, because usually you want to find, you got at least, the two houses, you need those sponsors. And then you want to find, people, as they hear on both sides of the aisle. But also you can look and see, are any of these, legislators, are they new parents or new grandparents? Do they, do they have a personal interest? I did, when I worked on heart disease stuff, I was very active in the American Heart Association, and they've got this very organized, legislative thing. And, they were always taking people, particularly kids with heart disease or had this or that, whatever, to legislatures to try to get certain things, passed or supported. And, it's effective. And they, again, they would try to, get someone from those districts, go to every member. And that's why, when we do the state, we have people in the, around the region. So, we need people, not just from Albany, we need to get people, from Erie and Long Island, and, we have 65 counties. So I don't know how many legislators we have, but, because how it's broken up. But again, there's maps, and, you try to get somebody from those jurisdictions, because they're always more interested in talking to somebody from their district, to move forward. And they're always worried how much it's going to cost and who's going to be opposed. And, you know, but you already have this worksite thing. So if you're just trying to, you know, improve it some, it's not, you know, you could argue it's not going to cost them a lot more or whatever or something. You know, and it's going to make it more equitable and it's going to improve. And, you know, we always, I mean, there's justification. People have, you know, Melissa Bartuk's done a number of studies. You know, if you increase breastfeeding, you're going to reduce, you know, the cost of healthcare, you're going to reduce infant mortality, all that kind of stuff. So, you know, we're doing, I'll put in a plug, we're doing breastfeeding grand rounds. I think it's October 12th. It's focused on worksite, and we're going to have New York State, and we're also having, so New York State Department of Labor, U.S. Department of Labor. We're going to have Better Balance speaking. I think the Family Law Group speaking. And again, they're going to be focused on worksite legislation. Again, how you put it all together, because here's all these different laws, but here's, you know, if you're an individual, you know, new parent or whatever, you know, how do I put these all together? And these laws are all, you know, they're additive. You know, they don't, you know, some laws can preempt and other laws, none of them preempt. They're all additive. So, so that's all good. But I will send you the link to our what we call breastfeeding grand rounds in October 12th. So, and we will record it and it'll be available and people can get, you know, continuing medical, nursing, lactation, public health credits.
Who is that? Who is that? Is that from New York State Public Health? Who is the actual main sponsor of that?
Actually, the WIC program, New York State WIC program funds it, but a number of people work on it, and it's we have a contract with the University of Albany School of Public Health.
Okay, is that something that y'all do every year?
Yes, they do it. Yeah, they done it every year I've been here, and it's grown, and we try to do a topic that's that's current. You know, we did something during COVID and breastfeeding during COVID. Last year we did reducing breastfeeding disparities, and we had Ann Mearwood, who will be making has a great press release coming the 28th. I will share that press release on the 28th. She was just funded to work on very exciting project. She worked on CHAMPS, which was she was the hospital, so baby-friendly hospital initiative, and she combined it with a community initiative where she recruited, people from the community, because you need both. You need not just the hospital, but you need the community component to try to reduce breastfeeding disparities. And she's published a number of papers and been very successful. And she will be leading a big initiative. Like I said, the press release is coming out the 28th. But anyway, she was one of our speakers. And again, talking about reducing breastfeeding disparities. So that was kind of exciting.
Which law do you think of all of those that you have passed has made the most impact? I know you kind of said that you think it's additive, but I guess for us in South Carolina, we've got two laws. We've got our public breastfeeding law. We've got our employee breastfeeding law, and I think that's mostly it for South Carolina. And myself, I'm not exactly sure how the federal law and our South Carolina law differ, right? Like, I'm not sure. I think the federal law is more adds more protection, but I think our South Carolina law was not too bad. I think it was one of the better laws when it was passed. Right. But kind of what law do you think has been the most vital that y'all have passed?
Well, paid family leave has had such an impact on so many people, and I've seen it, personally and professionally, because there are just so many people who did not have we didn't have paid leave, after they had their child. And so many people, my age or whatever, I mean, they're having, their children are having kids now. And I work with a lot of people who are younger, and they're able to take that time off that, people couldn't do, just, it passed in 2018. So just, 5 years ago, people just couldn't take that much time. And, and we're seeing this big increase in use by, second parents. And I just think that is going to have, it's going to have a big impact, not just on breastfeeding, but on mental health. We don't know yet whether it's going to have an impact on, depression, postpartum depression. But I think just, it's hard for young parents. I mean, it's very stressful, newborn babies don't sleep and the parents aren't sleeping. And it's just, they really need that time for themselves. So, and we've seen, additional, benefits. We've seen improved immunizations. I just saw a paper was looking at reduced emergency room use, afterwards in states that have paid family leave. There's studies that show increased job retention, increased morale. People are happier at work, which are things that, employers should care about. It's very expensive to have to hire new people. I just think as it becomes more normative and it's gonna continue. But I mean, I guess it's just, all these people who, work for me or under other people or whatever, they're just taking their time off and it's becoming, oh, that's normal. I take my 12 weeks or something, or longer or something. And, that just wasn't the case, definitely wasn't the case like 5 years ago, 10 years ago. So, I just think that's a big difference. And, like I said, there's, more, I review manuscripts and I'm seeing more and more manuscripts come to review, the benefits of paid family leave. And they look at states with paid family leave versus states without paid family leave. So, I mean, a federal leave law would be good, but certainly, I think, more and more states are adding various things. Some are 8 weeks or whatever, 4 weeks, it's how to do it. New York did it through an insurance program. That's how our temporary disability insurance works. Employer pays part and the employee pays half, pays part. That's 50-50. And then paid family leave, it's totally paid for by the employee. And then it's run through an insurance program. So it has to, they keep changing the rate to make sure that it pays, but it's, people just accept that. And then, of course, the other part is caring for someone with a serious illness. That's usually an older population that's taken it. We've looked at that. And there's very few, military, but anyway, that got, buy-in from that group. So, I don't know. I see Cheryl's on the call too. So, I mean, I think, we need paid, at the federal level, we need it, but certainly as more, for a lot of legislation, as states do it, it's kind of the, the testing ground trial. They do different ways and see what works. And there's enough states that have bought in and people who are supportive that finally you get a federal bill. I think that's important. And even, employers who offered something before, I don't know, like I said, I'm a relatively new grandparent. I saw for both my daughter and son-in-law, I mean, their companies matched the difference. And their companies hired someone who, did the paperwork. So they took advantage of our temporary disability insurance. They took advantage of paid family leave. And my daughter got 6 months of fully paid leave. She works, in IT. It was a great job. Great. My husband, my son-in-law didn't quite have as much, but his company, they took advantage. They did the state, and then they topped it off. But so you're seeing even businesses that are offering, they're supportive. So and, because of the, job retention and morale and all that, I mean, there's, there is buy-in for employers once they realize it.
Right.
That it does help them.
And our state, as Lori Phillips posted, our state has passed a parental leave law recently, but that's only for state employees, so that leaves the vast majority of employees in the state left out, so we do have some protection for a few people.
But that's starting to build the momentum. You've got
Right.
one, because we just passed, our state employees now get 100% salary reimbursement. So it's like each little increment, mental thing. So, so you've got some people. So, I mean, one can build on that. Could you take that model and then expand to, state employees? What about county employees? Other groups or something? How could you, build it out?
Right. And back to the, you really had to build a coalition to do this parental leave bill, so it's not something that the Breastfeeding Coalition can do. It's something that takes, a true coalition of different partners around the state, maybe with different reasons for getting it done.
Right. Yeah. I just, for a variety of reasons, I don't know. I was got involved in working with groups who were advocating for paid family leave, probably, I don't know, 15 years ago or something, a long time ago, and there were people, and that included Better Balance. And I mean, a number of people, again, within who were working on the idea. And, we have a number of coalitions for various, subpopulations, that were working on that. And, and so, I mean, it came over time. It was a long time in making. And again, how do you get the support, and who are the people, and how do you craft the bill and pull the groups in? And, because it's more than just newborns, that'll get you all the public health people, but
right.
caring for seriously ill people. Now you're going to get the, the cancer groups and, a lot of those health groups. AARP is, a big deal. They have a big membership. I mean, they're supportive of that. And some of the unions, particularly the unions for, lower, I don't know, middle workers, not the Google people, not the IT people, but, we had a lot of, I don't know, 11, they have numbers, 1179 or something. But some of the big unions got involved, and they were helpful. So, and there's groups, I know Better Balance works with states and things. There may be people in your state who are working on that. I mean, AARP's got chapters everywhere, and that's on their agenda. There's a number of groups. AAP has it on their agenda. I mean, there's a number of groups that have it on their agendas, and I'm sure a lot of them are in South Carolina. And again, there were people who put it, the resources to put together.
Well, I wanted to thank you so much for speaking. We've learned a lot. I'm very excited about that document that you put together, because that's going to be a really great resource. I'd love to ask a lot more questions, but we will go to our next speaker. Cheryl, I am going to butcher your last name if I say it. So would you mind saying it for us?
Sure, it's Lebetovich.
Okay. So I felt like I almost could say it, but I didn't. I'm just going to share your biography. Again, Dr. Dennison, thank you so much for being here. I hope that you stay for the rest of the meeting, but I understand if you have other things. Let me read your biography. Cheryl, just give me 1 second to share my slide, because I don't have it memorized. There we go. Okay. So Cheryl Lebedovich serves as Senior Policy and Communications Manager at the U.S. Breastfeeding Committee. She leads the U.S. BC Policy and Communications teams and serves as co-steward of the Workplace Support Constellation. She serves as the Editor-in-Chief of the weekly e-newsletter Staying Abreast, Weekly Wire, which I'm sure that we all are familiar with, and is a contributing author to the Office of Disease Prevention and Health Promotion report, The Role of Law and Policy in Assisting Families to Reach Healthy People's Maternal, Infant, and Child Health Breastfeeding Goals in the United States. Cheryl joined USBC in 2009 and has held many titles and responsibilities during her time with the organization. She holds a bachelor's degree in English from the University of Illinois at Chicago, completed an undergraduate fellowship at the Newberry Library, and is currently attending the University of Massachusetts Dartmouth as a Master of Public Policy student. Cheryl lives on Cape Cod in Massachusetts with her husband and children, who can frequently be spotted at BC events. Welcome, Cheryl. Thank you for coming to speak with us today. And I'm just going to unshare my my slides here.
Sure, and I think I can then show.
So if you, it's the little square with the arrow in it at the bottom. Yeah, there you go.
Okay. Did you see it? Okay,
Yeah.
so what I was invited to come here to talk about today was the passage of new rights for breastfeeding workers. Mostly going to concentrate on the Pump for Nursing Mothers Act, but also want to talk a little bit about the Pregnant Workers Fairness Act. I think most of you are familiar with the USBC, but we serve as a coalition of actually more than 130 organizations at this point that support our mission to drive collaborative efforts for policy and practices that create a landscape of breastfeeding support. And really, we serve as a convener, so bringing organizations together where there is common ground and big, audacious goals that are bigger than any one organization, and really providing an opportunity for organizations to come together in collaborative action. This is me. Wanted to start out before diving into the content, just flagging that we have access to new data from the CDC. So each year, the National Immunization Survey really is a source for a lot of the key data that we depend on to really guide our collective efforts. And every other year, the CDC produces the breastfeeding report card that comes out in even months or even years during National Breastfeeding Month. And even though this year is not a breastfeeding report card year, there is the new data that is available. So this data is for 2020 births, which, as you can imagine, we're going to be probably pulling a lot of insights out of the babies born in 2020 and 2021. If you use your phone, you can scan that QR code right on your screen, and that'll take you to the page, or just search for CDC breastfeeding data. Also, I'm actually coming in right now from New York because I'm here with many of your friends that you all know and love, including Tina Sherman and Jessica Lee, because we have teamed up once again, the Center for Work-Life Law, the National WIC Association, Moms Rising, ACLU, and A Better Balance, to really celebrate the passage of new rights for parents. So, we just came from an event in Times Square that included Congresswoman Maloney, who was a champion during her time in Congress for many pieces of legislation related to pregnant and postpartum workers. And hopefully any moment now, there is an ad that is going to go up on 2 screens. So if you scan the QR code, you're going to see where we're really directing information, people to new information, consumer-friendly information about both the Pump Act and the Pregnant Workers Fairness Act. And this is really out of recognition that we've passed these really amazing laws. They were really groundbreaking, historic progress. But of course, passing those laws is only part of the work. So now we need to really make sure that people know about it. So we were provided with this opportunity to celebrate in Times Square. We wanted to make sure to flag that. I will be flying home in just a few hours. So if you have questions for me, I encourage you to please reach out. Don't hesitate to email me, but know that I'm traveling. So I might be a little slower than usual. During the presentation, I just wanted to talk a little bit about new laws protecting breastfeeding workers. Like I said, Pump Act and Pregnant Workers Fairness Act point you to some shareable resources to help spread the word, where you and the families you serve can go for help. And just want to say, like, don't stress about the details. This really is about becoming familiar and comfortable with the overall ideas. You don't have to be a lawyer to support breastfeeding families. You don't have to be a lawyer to breastfeed, because there's a lot of organizations that are truly dedicated to helping folks. So if we know that those rights are available to us, half the battle is won. So starting out, I'm going to talk about the Pump for Nursing Mothers Act. I think a lot of you are probably already pretty familiar with it. So this law, signed in December 2022, the 11th hour of the 11th hour of the 117th Congress, the Pump Act was signed into law. And under the Pump Act, lactating workers have an explicit right to reasonable break time and a private non-bathroom space to pump during the workday. So the reasonable break time needs to be provided each time that employee needs access. So anytime that they need to pump, really, which is out of recognition that the frequency of pumping sessions as well as the length of pumping sessions are going to vary from parent to parent, as well as over time as that baby grows. It also requires a private space to pump. So it cannot be a bathroom. It has to be shielded from view and free from intrusion from both coworkers and the public. So this is a really important part, is really making sure that we have safe, hygienic spaces for moms to pump when they're at work, and a way to keep their milk safe for baby, and that these accommodations must be provided for 1 year following the birth of the child. So there's been a lot of misunderstandings about that part, because as the bill moved through Congress, in the House passed bill actually would have extended this to 2 years. However, that wasn't included in the final bill that was signed into law. So just want to flag that it is unfortunately still just for 1 year after birth. And so want to talk a little bit about why that Pump Act was needed. So probably most of you know that back in 2010, as part of the Patient Protection and Affordable Care Act, there was a provision within this huge piece of legislation called the Break Time for Nursing Mothers provision. So that is the very first time that federal law addressed the needs of lactating workers. And it required, very familiar, reasonable break time and a private non-bathroom space to pump. However, basically it was a provision that was placed within existing statute within the Fair Labor Standards Act. And what it meant, because of where it was placed inside of that law, it left out a significant portion of the workers who actually need access to these protections. We have some really wonderful partners at the Center for Work-Life Law and EPI who crunched the numbers and actually found that 1 in 4 women of childbearing age were not protected by the Break Time for Nursing Mothers law. So of course, that was a major problem. Teachers, many nurses, agricultural workers were left out. The other really big issue out of the Break Time for Nursing Mothers law is that there wasn't a whole lot that an employee could do if their employer refused to comply. So under the Pump Act, for the very first time, every worker now has the opportunity to actually file a lawsuit in the event that their employer is not complying with the requirements of this law. So we aren't, anticipating that there's going to be tons of lawsuits. That's really not something that most people with a newborn are really wanting to go through, but having a consequence, like a real risk for that employer of not complying, we're expecting to have a really big impact on, inspiring them to get with the program. So as you can see here, kind of what changed is that the Pump Act expanded these workplace pumping protections to almost all workers. There are still a couple of gaps. So there's a 3-year implementation delay for motor coach operators, so like railroad engineers. There's also a exemption for flight crew. So anyone who works for an airline is protected unless they are a pilot or a flight attendant. So there's another bill that's been introduced this session that would expand protections for flight crew. And there's also provision in this year's FAA reauthorization, so the Federal Aviation Administration, which would require the FAA to produce guidance on what it would look like for the flight crew to be able to have access to these same protections. A lot of this language all of the language has really been thoroughly developed with the pilots union and the flight attendants union out of recognition that safety is really key, and it's very clear that this absolutely can be done safely in that context. Also, like I mentioned, the PUMP Act changed by providing employees with a private right of action, so the ability to file a lawsuit if an employer does not comply. And we'll talk a little bit later on about what an employee can really do, where they can turn for help if they're not being accommodated. It also had some clarification that around while breaks are unpaid, really clarifying that if an employee continues to work while pumping, the time must be paid. So this is already an existing, was actually the law from the get-go, but it was such a problem that it became important to have that included in the statutory language, because a lot of times what our folks who run free legal helplines were really seeing was that even though a worker was pumping, they were answering emails, answering phones, that kind of a thing, and still being docked pay, which is not okay. So I think one of the really important pieces in our role now amongst the lactation field, kind of where do we go from here now that this law is in place, is around educating families on their rights. So like we said at the top of this presentation, like passing the law was a really huge monumental step forward, but it's really important now to keep at it. So new babies are being born every day. Folks who don't have children maybe aren't paying attention to these kinds of messages. So it's really important that we're continuing to spread the word over and over and over and reaching new families. Also employers, so that they understand what they're required to provide and the risks if they don't provide it. We know that that law is a huge driver of cultural change. It wasn't that, only a couple generations ago where seatbelts weren't normal. And then we have laws that required them and they became normal. And so hopefully now where we have a law with some teeth in it, some strength, some consequences if you don't comply, what we're really going to see is this becoming normalized in workplaces. So really encouraging you to spread the word far and wide about these workplace protections anywhere you can. And the QR code that's right on this link here, that's pointing to a webpage that has all kinds of implementation resources. So the Department of Labor has done a really fantastic job of doing really proactive outreach to families all over the country. I've seen them working with like baby store, like maternity stores and all kinds of things. And they've even developed these purple images that you see on the screen here, some really cool new resources, including a Know Your Rights little wallet card that was in high demand. I think it was about 24 hours after the bill was signed when folks were asking about when an updated version of that would be released, as well as this door hanger that you see on the right-hand side. If you use the QR code that's in that bottom left, you're going to find direct links over to these resources from the Department of Labor and from so many of our partners. Moms Rising, Center for Work-Life Law, A Better Balance, USBC, lots of resources from across the field with really easy consumer-friendly information, as well as information for employers, information for coalitions like yours or other organizations to help spread the word. The QR codes on these DOL resources are too small to work, but you will find links to them, and the QR codes do work when you look at the full version of them. On that webpage, but is also a link to the Office on Women's Health Supporting Nursing Moms at Work resource, but I wanted to make sure to lift that up specifically. So I think one of the really important roles that we have, actually my sister came with me to this fun event in Times Square, and she was saying how, she didn't even know that wasn't like to even ask for a space beyond a bathroom. And I certainly felt the same way. I was like, wow, this is, what a gift I've been given. And it really kind of takes help to understand, like, actually, this is okay to expect. And there are ways that really simple, inexpensive, often free creative opportunities to absolutely provide the support for employees and still fully meet the needs of their business. So the Office on Women's Health Supporting Nursing Moms at Work resource is a great place to start there, and really helping people think through, like, what is a solution that works for me? I think one of the interesting things about the PUMP Act is that it's pretty vague language: reasonable break time, private non-bathroom space. So it's not very prescriptive. And that's out of recognition that every workplace looks different. So the built environment looks different. The specific employees' responsibilities are very different. So what pumping solutions would look like for one worker in one location might be very different from someone else. And we really see that the outcomes are the strongest for moms and for families when they are, first of all, talking to their employer very early on about their intentions and coming at it with a clear solution in mind, saying, like, given what I need to do during my day, this is what I think would work for me. So some questions to think through: does that employer already have a policy in place? Are there specific time and space considerations that they should keep in mind given the specifics of their job or their environment? And the Office on Women's Health has this resource which can be really helpful to kind of think that out. It has examples from businesses all across the country, and so it can be a great place to look for ideas as folks are trying to think that out. So as I mentioned, there are going to continue to be moments where there are employers who are not willing to comply, or employees are not having their needs met. So thankfully, you don't have to be a lawyer in order to help these individuals. There are organizations who provide these supports and do it so expertly. So we're very lucky to be able to point them to these places for support. And I really encourage everyone to really spread the word far and wide. So if an employee is denied time or space to pump, they can call the Department of Labor Wage and Hour Division. So this is the agency that's in charge of enforcement. They can answer questions. The person could decide to file a formal complaint, which would initiate an investigation. One thing to know is that if the Wage and Hour Division does show up at a workplace, they could be looking for things that aren't just related to that pumping scenario. They could be looking for other violations of wage and hour laws. So that it comes with risk for that employer. They should really be working hard to avoid that scenario. A lot of workers are hesitant to go right to the Wage and Hour Division, and thankfully they have other options. So the Center for Work-Life Law, which comes out of UC Hastings in California, hosts a free legal helpline, and you can see the phone number on here. There's an email address. They offer support in both English and Spanish, with other languages available upon request. We refer folks here all the time, and they do such a great job of really helping workers think through what are their legal protections and what can they do to really make sure that they're securing the accommodations they need. One thing to really flag, and the Better Balance also hosts a free legal helpline. So again, there's a phone number you can call. And if you click that QR code, you can get direct links over to the Center for Work-Life Law and a Better Balance helplines. These are just incredible resources. They're amazing partners who the SBC really values and cherishes. And the really great thing there is that it can be so complicated to figure out. It's not just actually about federal legislation. It's also about what are the state and local laws that apply to you. And they're a really great resource for sorting that out with the individual. So please consider posting those links everywhere you can. And I just wanted to take a moment to just really express appreciation for the coalition, for so many of you, familiar names and faces, and folks across the country. Like it's no small thing to pass a federal bill, and it truly wouldn't have been possible. It was tens of thousands of emails from constituents. It was hundreds of organizations speaking out, signing on to letters, sharing their own letters, having meetings, legislative champions. I mean, this was an incredible victory, and it was a collective victory for all of us in the field. I'm going to check my time. Okay, I got 8 minutes, and I'm going to leave a few moments for questions, so I'm going to zip through this. So the other piece of legislation is the Pregnant Workers Fairness Act. This was actually signed into law at the very same time as the Pump for Nursing Mothers Act. Huge, huge, important victory. Many of the same partners really were champions for these bills. And the PWFA requires reasonable accommodations for pregnancy, childbirth, and related medical conditions, which includes lactation. So absent undue hardship. So if an employer and employee need to get into a good faith conversation about what are reasonable accommodations to help keep them on the job. And this is really an affirmative requirement for employers. It's enforced by the Equal Employment Opportunity Commission, and they've just released draft regulations about kind of what is this really going to look like. Reasonable accommodations, as you can imagine, can be much more expansive. So the Pump Act, it's like clear, it's time and space. Reasonable accommodations could be much more all-encompassing. So it can include things like light duty. It can include things like time away from work. It could include things like having a uniform that fits you right during pregnancy or while breastfeeding. And it can really include a much more expansive list of the types of accommodations, extending through the whole reproductive cycle. So I really encourage folks to take a look at those draft regulations that were released and consider sending in some comments. Even if you're with a government agency, public comments are not considered lobbying. So the government is actively seeking input from the field. And this is a really great opportunity to help strengthen the regulations around the Pregnant Workers Fairness Act. If you go to this QR code, you're going to see all kinds of consumer-friendly information from the organizations who are the real experts on this piece of legislation. And it's really exciting news, and provides an opportunity to really meet a full spectrum of needs for pregnant and postpartum workers. Wanted to flag very quickly the Pregnancy Discrimination Act. This is a law that's been on the books for a very long time. And the PDA prohibits discrimination based on pregnancy, childbirth, and related medical conditions. It's also enforced by the Equal Employment Opportunity Commission. So kind of the bottom line is that if an employer is accommodating an employee who needs something similar to what a lactating employee needs, but not accommodating that lactating worker, this could be considered discrimination. So the Pregnancy Discrimination Act has been on the books for a really long time. It did prohibit discrimination. It was a major advancement for pregnant workers. However, it was really the gaps in here that led to the development and the passage of the Pregnant Workers Fairness Act, which is an affirmative requirement for accommodations. And of course, the Family and Medical Leave Act. I know Dr. Dennison was just talking about paid leave, but we do have right now the Family and Medical Leave Act on the federal level, which provides up to 12 weeks of unpaid job protective leave for eligible employees. So this is important information to share, and hopefully soon we will have a national paid family and medical leave program so that people can really, be a human being who gets sick and has loved ones and gives birth and all these things. So yeah, to close, I think anything that all of us can be doing to share information and resources really widely with clients and communities, not just like today and tomorrow, but for all the generations to come, and encourage you all, if you're not already signed up for email updates from USBC, to do so, because you'll see all kinds of information released whenever someone from the field has new resources or anything like that. We do try to share it. I think that was it for me. If you have any questions, please feel free to email me. I will say that one thing about USBC is that I really see our role as knowing who is the experts in the field. So a lot of times it might not even be that I have an answer for you, but I'll do my best to make sure to connect you to the folks who do have the answers. So please feel free to reach out anytime. And I'm happy. I think I only have like 3 minutes, but I'm happy to answer questions.
Does anyone have any questions for Cheryl? I have a question.
Sure.
Mine is more sort of mechanical, I guess, or technical. Can we, I don't know if you could send us your PowerPoint and how much that can we use like in our e-blast, and like, can I copy those QR codes out and put it in so people, our membership can use it? Is that all okay? Like I usually
Borrow
like
shamelessly. Yep, definitely. I'll send over my slides. I might need to send it as a link if the file is too large, but absolutely feel free to share. And those web pages, all that information, absolutely feel free.
okay, so I can do like a little snip and like pop it in my e-blast and that kind of thing. Is that okay? Okay,
Yeah.
because I really like for people to have those QR codes and those resources. So I'll pop those in there. And Romaine, you can pop them on the Facebook page and all that kind of stuff. So that'd be super. So, and does anybody else have any questions? So I guess I was just, well, I think I did not give you enough time to speak because I have so many questions and we have 1 minute. So I'd love to know more about the Pump Act and, you know, kind of like the timeline on that. And what, I guess just briefly, what is your timeline on that Pump Act for trying to get more people covered, the rest of the folks covered?
Yeah, so there's 2 different bills that have been introduced this congressional session. So one of them is called the Pump Technical Correction Act. I can try to find a link while I speak to point you to active legislation webpage, where you can actually find the direct links to those bills. So the Pump Technical Correction Act is actually fixing a very minor thing, which we're hoping will pass pretty smoothly. Because Capitol Hill workers were actually left out of the final language. So like Capitol Hill police or like legislative staffers, you know, Senate aides and stuff, don't currently have the protections under the Pump Act. It's a real easy fix, bipartisan. There's also the Air Pump Act. So that's the bill that would address issues around flight crews. I will say there was incredible opposition. There was incredible opposition from the airline industry. So I think that the likelihood of that bill passing is pretty small. However, this FAA language is, you know, with required guidance would be a big step forward and is really been negotiated and supported by those workers themselves. My colleague here is in the room because we were all at the event together. Also wanted to flag that she's so smart, Jessica Lee, that workers who are left out of the Pump Act are protected by the Pregnant Workers Fairness Act. So they're not left out in the cold. You know, these bills really are critical and working together. So they are able to access, again, reasonable accommodations, pregnancy, childbirth, and related medical conditions, including lactation. So there's hope.
Great, good to hear. Thank you so much for coming, especially taking time out of your busy schedule out there in New York City today and and agreeing to do this for us. We really appreciate it. So thank you so much.
Thanks for having me. I'm gonna just pop my my email into the chat. Please feel free to reach out anytime. And then I'm also just going to pop in the link to our Take Action page, because you can find links to all of our different action tools there.
Perfect. Yep. And I think I know that you guys had sent something out for the Air Pump Act, and we are going to go ahead and obviously participate in that with South Carolina, whatever you guys had wanted us to sign a letter or something like that. So
yeah. Thank you so much. I am going to hop because I'm going to go adventure around the city, but thank you so much for having me.
Yeah. Have a good time. Thank you again so much.
Thank you. Bye.
Bye. All right. We're 2 minutes over. I apologize. I'm just going to hop back to my slides so I can introduce our next speaker. Our next speaker is Luciana Roldan, and she serves as a community outreach and resource planning specialist for the state of South Carolina. She began her career as an investigator with the Wage and Hour Division in Columbia District Office in 2020. And after serving 21 years as in the U.S. Army as a human resource officer and 3 years in the private sector as human resources director, she holds a bachelor's degree from Texas A&M and a master's degree in human resources management from Webster University. As an investigator, she enforced a variety of acts that included MSPA, agriculture, child labor, fair labor standards, medical family leave, and H-visa immigration programs. And Luciana, thank you for agreeing to come and speak with us today. I think you were going to speak about some resources that you could share with us.
Hello, how you doing? Thank you. Well, I am gonna talk about the Pump Act, but I'm not gonna pump you out so much. I know you have received a lot of information about the Pump Act, and Cheryl, she explained it beautifully. So I'm just gonna touch on certain things. Just do like a little dive deeper, and then that the way you can have a phase with the wage and hours. So, and I'm able to share my screen, correct?
You are. Go down to it's usually on the bottom, you'll see a square with a little arrow in it, and that's the share screen.
Perfect. Okay, so trying to see. Okay, I see it. Okay, I think so. I got it. Can you see it? I think so, right?
Not yet. It might be taking a minute. Sometimes, so it depends if you share the window or the tab. Let me make sure I stopped sharing because that was a problem last time. Yeah, mine doesn't say it's sharing. And I think you had sent me your presentation too. So if it doesn't work, I can share it, right? But let's try maybe one more time and see if we can, if it'll come up.
I'm gonna try it again. Sorry.
Oh, don't apologize. I think this is just.
I was able to see it from.
Here it is. I think this is coming down.
There you go.
Oh, darn it. Nope, it's not there. When you're sharing, are you sharing the tab or the window?
I'm using the window. Yes.
Try the tab. See if it'll come up with the tab. Is it on a tab or is it?
It's on the window right now. So let me see. Can you see it or no?
Let's see. I do not see it. It's just coming up with it's your computer. I can see if I can, I know you sent it to me. So let me see if I can share it really quickly.
Okay.
How about And then you can just tell me like when to advance the
Yes,
slide.
yes.
Um, Okay, so this is actually, I think what you sent me was a PDF.
Yes.
Do you have the PowerPoint? Do you have a PowerPoint for it, or was it a PDF that you were sharing?
Yes, it's a PowerPoint, but the thing is, my agency will not allow me to send the PowerPoint. It has to be the PDF file that I can share. And I'm sorry, those are federal, agencies law. So
I think this will work though, because it looks
Mm.
like it's big enough. Let's see if I can shrink it a little bit.
yeah, I can see it.
How's that? Does that work?
Yes, I can see it.
Here, let me do one more little shrink here. How's that? Is that
Yes.
okay?
That's okay. That's good.
All right, everybody else can see it okay? Okay. All right.
Yes.
Great.
All right, we're good to go.
Yes, good. So thank you so much for inviting me. And like I mentioned before, my name is Luciana Roldan, and I'm the community outreach for the U.S. Department of Labor, the Wage and Hour Division. The agency that the speaker prior, Ms. Cheryl, was saying that we are the ones that enforce the Pump Act. So yes, so very excited. So a lot of the information is gonna be kind of repeated. I'm gonna try to go, just past that because I don't want to like double you on Pump Act information. But one thing I want to mention is that my agency not only enforces the Pump Act, we also enforce the FLSA, which is the big labor law that protects most of the workers in the United States and deal with overtime, minimum wage, child labor, record keeping, and of course the Pump Act as well. And also we enforce the FMLA, the Family Medical Leave Act. So during the presentation, I'm not going to talk about the FMLA or any other laws that we enforce, but have in mind if you have any questions about wage and hour laws, please let me know. We also do all the immigration laws like the H-2A visa, agricultural workers, and any government contracts, projects with prevailing wages. So I'm gonna share my information. Please give me a call if you see anything that you see that you want to like talk a little bit more, or if you would like to partner, especially with child labor. We're looking for partners around the community because we have seen a big uptick of violations in child labor. So yeah, just a little bit. I just want to see like a story. And so in 2002, I was in the military, and I was a very young soldier, and I gave birth to my son, and so I wanted to breastfeed my son and nursing him, and so when I went back after 8 weeks, I went back. The military at that point was very restricted, and I was not able to nurse my baby, and I felt so guilty because I was not able to do that because there was no laws there that really protected me like it's now. So fast forward 20 years, and I gave birth in 2020 again. And this time I felt so much better knowing that not only the community and the government and my employer was supporting, and it was a total different experience for me as a mother. So I'm very proud that our country has decided to move a little bit more progressive in this, and this is just basic needs for all workers. So full circle, I'm now talking about the Pump Act. So next slide, please. And I have a very, very southern accent, all the way southern to Puerto Rico. So if you have any question, put it in the box, and I'll like try to explain it better. So this is a disclaimer saying that this is a information. It's a presentation is intended for general information and do not carry any force or legal opinion. So, and we try to keep our information as current as possible. Some agencies will have more current information, especially if they deal with Capitol Hill. Sometimes the information that we receive has to be vetted before we can actually present it. So there's a little bit of lag time there. So next, please. So as we talked earlier, the Fair Labor Standard Act, the FLSA, is the law that established minimum wage, overtime, and child labor for most of the public and private employers. Under the FLSA, that's where the reasonable break time for nursing mothers was established. And like the lady prior to me mentioned, it was under the overtime provisions, which excluded many workers in our economy. So they removed it from the overtime, put it in another section, and now more workers that were exempt, meaning that they were exempt from overtime, typically salary employees, now are protected under the law. So so pretty much, as you know, the provisions state that employers have to provide a place where nursing employees can express their milk. So next slide, please. Oops. Yeah. Yes. So like I mentioned prior, so teachers, nurses, farm workers were not covered. So now they are covered. And of course, they are exemptions like we mentioned prior. Some of the rail and air, rail, and motor coach workers are not, we're still working on to that. So, but these are the workers now that are protected. But one thing that we have to, I need to talk a little bit is about coverage. So it's like jurisdiction, right, of the law. So the FLSA covers certain employers. So imagine the FLSA, it's a big umbrella, right? And there's two types of coverage. There are individual coverage, means that each person individually is covered, and then there are enterprise coverage, meaning that the whole company, the whole employer is covered. So when we go in and do investigations, that is a very important factor that we have to consider before we can actually initiate the investigation. So enterprise cover means that that company or that employer, their annual dollar revenue for a year is $500,000 or more. So if they make more than that, they are automatically covered, and all their employees under them are covered, meaning that they not only have to follow the Pump Act and the reasonable breaks for nursing mothers, but also they need to pay the minimum wage, pay overtime, and follow the regulations for child labor. So if for some reason that's a small company and they do not make more than the $500,000 a year, then we look at individual basis. So let's say a gas station, for example, they might not make that much money, but if we look at that person, the cashier, she is handling credit card, which they go across state lines. That means that they are engaged in interstate commerce. Therefore, that person individually is covered. So once we establish that they are both covered or the employee is covered, we can proceed with that investigation. So it's very important to know that, because there's also an exemption here for small businesses. So for us, small businesses mean 50 or less employees. And if they can show us that they providing these protections to their workers bring them in an unfair hardship, then they will be exempt. But have in mind that they have to prove that to us once we go in and do an investigation if they've violated any rights for the worker. So yes. Next slide, please. So like we mentioned prior, workers have different type of needs. Like you can see in this example, Irina and Leslie, both nursing workers, but one have a 9-month-old baby and the other one just returned from having the baby. So of course they're going to have different requirements or needs, and the employer needs to understand, that they have different requirements, and they need to be given the reasonable time to express their milk, regardless of how often or how or not that person is expressing the milk. Also, I want to mention that employees who telework are eligible to pump. I'm sorry. Oh, okay. So I want to mention the employees who telework are eligible to take pump breaks under the FLSA on the basis just as they were in a work site. And of course, they need to not be in the camera, and they have the right to turn off the camera. And one thing we mentioned about the unpaid breaks. So if the worker is pumping while they're doing their job, that time is compensable. So in order for the employer to claim that he's not going to pay for that break, that employee has to be 100% free of work. He has to be totally not doing anything, not answering phone calls, not answering emails. He has to be totally free. Also, under the FLSA, any breaks smaller than 20 minutes have to be paid. Anything over 30 minutes, they don't have to be paid. So just have that also in mind if the employee takes, a few 15-minute breaks, that those have to be paid. Additionally, if the employer provide a regular pay breaks, and the worker decided to use that time to express milk, that time is going to be just like anybody else using that 15-minute break. So, next, please. So we just talk about the compensation, and just like I mentioned, those breaks under the FLSA based on the time can be compensated or not be compensated. But one thing that is very, very important is the employee must be free of doing any work in order to be considered non-compensable. Next, please. So the space requirements, as you guys know, has to be shielded from the view, free from intrusion from co-workers and the public, and maybe used to pump breast milk. So for example, a bathroom, a car cannot be used. It has to be a place where they can lock the door. Other co-workers are not gonna be, looking at them, allowing them to have like a sign saying, pumping in progress, anything like that. Additionally, we are going to talk a little bit about the functionality of that space as well. Not only this is just the basic of the space requirement, but then we want to talk under the Pump Act the functionality of the space as well. Next, please. So a little bit about the rail care workers. So under the Pump Act, the new privacy protection for nursing employees of rail carriers working on passenger trains allows them, for those employees, to temporarily obscure the view from recording devices when the train is not moving. And these protections was effective on December 29, 2022. And this still like we talked earlier, we're still waiting on amendments from the law or addition to cover these employees. Next, please. So now to the functional space. So once the employer do not have to have a specific place designated, like, you know, it can be temporary, it doesn't have to be permanent, correct? But we ask the employer, when we talk to the employer, that if they have to take in consideration how many nursing workers are within their ranks. So if they have, I don't know, 5 or 6, and they have to understand different schedules, that they might have to provide more than one space for that worker to express milk. So when we look at an employer, correct, and the employer has, let's say, 2 restaurants, and each restaurant have 25 worker in each, that employer is covered under the FLSA and under, well, of course, if it's covered on the FLSA with the revenue for the year. But because they have 25 employees in one restaurant and 25 employees on the other restaurant, and they are considered an enterprise, that means that that employer must provide, will be in compliance, will need to be in compliance with the Pump Act. Another thing is the space. The space have to be a place where the person can sit down, not in the floor. You have to have a chair, flat surface, to put the you know, all the materials, the machine, everything like that, and a sink where that person can also clean up the you know, the pieces, and then a place where they can store that milk as well. So that is part of the functionality of that space that also have to be in compliance. Next, please. And we already talked about this undue hardship exemption. And again, it's the lucky number is 50 or more employees to be covered. 50 or less can apply this exemption, but they have to show us that it presents an undue hardship if they compile with this provision. Next, please. So we understand that there are some interaction with state laws. So with FLSA and any law that we enforce, if the state law it's provide more protections, we will defer to the state law. So the employer have to abide for state law and federal law. But if there's greater protections under the state law, then we will go. And I know, like New York have better protections that some of the federal laws, or therefore we allow the state just to enforce that law. So next slide, please. And a little bit about retaliation. It is a violation of the FLSA to retaliate against an employee that raised concern about their wages, their hours, or they want to file a complaint or present a complaint to us or to the local HR. So retaliation, they are protected. They cannot be fired, change their job to a job that is less, be harassed. So that also is covered under this Pump Act, and we are able to do investigations and also have remedies for retaliation or any violation of the FLSA law. Next, please. So an employer who violates an employee's right to reasonable break time and space to pump breast milk will be liable for any of the appropriate legal or equitable remedies under the FLSA. And the remedies can be restatement on the job if that person was fired, a promotion, payment of wages, loss, or the equal amount for liquidated damages. It can also include compensatory damages and make whole relief, such as losses that resulted from the violations, and also, like I mentioned before, punitive damages and appropriate. So these are remedies that were added under the Pump Act that were not in the previous provision. So this is we're very excited to have these remedies for the workers. Next, please. I had like 2 minutes.
You have, well, you can go just a little bit longer because if Lori doesn't.
Enforcement, we are the agency that enforces. So and I'm gonna talk a little bit about how to call us and the information to call us, and we accept third parties complaints. So if one of your clients express that that they're being violated for any reason, you can call us directly and do a third party complaint, and we will take that. So for enforcement, there are special notification that that require when the worker decided to do the private right of action. So they have to give, and I believe it's 10 days. They have to let the employer knows, hey, listen, I need accommodations. And then after 10 days, they can pursue the private right of action. That special notification do not apply to calling us. So you can call us at any time. You don't have to wait 10 days. And also, there's when we do the investigation, like the lady prior to me mentioned, we go in and we not only look at Pump Act related violations, we look at everything. We look at wages. We request so many documentation from that employer. So if we find something else, of course, we're gonna address those violations. So we can go back to 2 years on that payroll. So we can go 2 years past. So let's say the worker were, their rights were violated 2 years ago for the space, not for the space, but for the reasonable breaks. We can go back and try to resolve the issue, but have in mind that this law came in effect in 2022, so there's some limitations on the remedies for that. So and if we can find and we can prove, substantiate that employer is willful, we can go back to 3 years. And that's with all the investigations that we do as far as wage and hour laws. Next, please. So that's what I mentioned before. An employee can file a private suit regarding an employer's failure to provide a space to pump. The employee must notify the employer of the failure and allow 10 days for the employer to come into compliance. But if that employee was fired, those 10 days would not apply. If that person were fired, they can initially go and do a private action or contact us immediately. Next, please. So we have a not 24 hours. Let me not say 24. We have a toll-free number. It's 1-866-487-9243. And that it's a line. You will talk to a live person. And that person, it's a technician. It's fully knowledgeable in all the laws that we enforce and can take your complaint. We'll talk to you. Please have all the information as far as the employer's name, the conditions that brought that violation, their address, the name of your supervisor, because that supervisor represents the employer. Therefore, that person is also liable. So have all that information. Call us. Give us a number. We have a office as well. It's on downtown Columbia, and it's in the federal building. So you can also go and talk to us in person. And also you can go to our website and submit your claim using our website. We have a lot of information about not only the Pump Act with all the laws that we enforce. We also have maternal health information dealing with, using the FMLA and the Pump Act together and how they kind of like support each other. We have that as well. So please visit us. And also, I'm here local. Like I mentioned prior, if you need more information, if you have any questions about the laws that we enforce, or if you want me to come and give another presentation to your stakeholders, have me in mind. And next, ma'am. Next slide. And we got a little bit of the resources. And that's it. That's all I have. Any questions?
So I had a question. So the 10-day thing, I mean, obviously that would be a problem for people who are lactating, but what if a person is told they don't have time or space to breastfeed or pump, and we know the law says 10 days, and they don't get fired, the person doesn't fire them, like what should they do? Just keep pumping, at work? Do they not come in? Like, what would they actually do? They're supposed to give 10 days. You don't have 10 days on lactation.
Yes. For the 10 days, I don't know if I was clear enough. The 10 days is for the space. The 10 days do not apply to the actual break. So the 10 days is actually for the employer to provide the space. So, okay. And that's only for the right of action. But if they want to handle the claim through us, then the 10 days do not apply. Does that make sense?
Okay. So they can call you immediately, and they don't have those 10-day, right? Okay.
Yes. Yeah. The 10 days are only to give the opportunity to the employer to get in compliance with the space requirement, not the reasonable breaks. So the breaks, allowing the person to pump, it's automatically, it's immediately. The space will create a little bit more logistical from the employer. So allowing the employer to come up with the space, that's the 10 days. But they can call us anytime. That the 10 days doesn't apply when they call us.
Okay. All right. And then you had said, like, people had undue hardship. People had losses. So I guess that would be if they lost their milk supply because of problems, then they would need to be reimbursed for things like formula or doctor's visits or something like that. Is that the kind of thing that they can pursue?
Yes. So those are the type of remedies that we can pursue. And again, once the investigation is open, we have we do the interviews with the person, with the complainant, and we decide everything, and we will go forward and then get that person whole in all regards.
Okay. And then I had a question about companies like McDonald's or franchises, I guess. With franchises, are they considered a large, like if you had a very small franchise business, would that be considered an enterprise, or would that be considered just the size of the franchise itself? You know what I'm saying?
That is a great question, ma'am. So for the FLSA, when we look at franchises, we look at the ownership, right? So a lot of franchises are individually owned, let's say, right? So that when we go in, the employer says, well, you cannot count, let's say Sonic, right? And that franchisor have 7 or 8 Sonics, right? And he says to us, well, you cannot count all my Sonics because they are individually registered as an individual entity. For the IRS, that can work. For the wage and hour division, that doesn't work. For us, we see it as an enterprise because they are all connected and they are all owned by one person, even if they are individually registered. So when we go in and is Sonic franchise, and this person and his partners owns 8 of them, the whole 8 of them becomes an enterprise.
Okay.
And therefore, there are all the employees under that enterprise are covered.
Okay. And do you all, oh no, that was the equal employment. I was thinking about the uniform thing for the Pregnancy Workers Fairness Act, but y'all don't have anything to do with that. That was the equal employment
Yes.
division.
Yes.
Okay. Okay. Does anybody, I asked all my questions first. I'm sorry, but does anybody else have any questions? Nope. Okay. It is really great to, see you face to face, know that you're there for all our mamas and sorry, lactating parents in the state. It's really important, I think, for us all to be familiar with you and what you do, and really appreciate you taking the time to come and talk with us today. And it would be optimal if none of us ever had problems, and none of us had parents who encountered these difficulties, but we definitely do. And we have parents reach out to us as a coalition, and now we have more resources and for them, and can refer them to you, and we know who we're referring to. So that's wonderful.
Yes. And one
Thank
thing, ma'am, the resources that Cheryl showing her presentation, like the door handle and the cards, I have many of those resources in actually paper copy. So if any of your stakeholders, anybody would like actual, let me know, send me an email. I put my email in the chat box, and I can stop by, and I travel around the state. So if you want me, I can mail them to you guys as well. So let me know if you need them, because we have them. That way you don't have to print it, and it's actually the real ones. So.
Is that something that we could get for our conference in January? We're doing a conference in January.
Yes.
Could we get a pile of those? Okay. All right. Super. That would be great.
Yes.
And then our in-person events later. Okay. Super.
Yes, ma'am. Let me know. You have my email, and I can drop it off, or I can mail them to you.
Okay, perfect. Thank you. Well, thank you again so much for speaking. Lori, I'm sorry, we're backed up a little bit. Let me just switch over my slides here, or my screen, and start another one. Okay. I want to introduce Lori Phillips. She's the director of the Division of Nutrition, Physical Activity, and Obesity Prevention at the South Carolina Department of Health and Environmental Control. In this role, she and her team support equitable opportunities for healthy eating and active living statewide through the facilitation of collective state-level actions. She is a master certified health education specialist and certified results-based accountability professional with over 20 years of experience in community-based chronic disease prevention and education at local and state levels. Mrs. Phillips received her Bachelor of Science degree from Clemson University in Health Science and her Master of Public Health degree in Health Policy and Administration from the University of North Carolina at Chapel Hill. And thank you, Lori, for coming. I know you were going to speak a little bit about what a grant that you guys have applied for, which addresses some of these issues.
Yes, let me figure out how to share.
There we go. Perfect. It's
Coming
up. Yep, yours is coming up. Sometimes I do, sometimes I don't, I think.
Okay.
But yeah.
Well, thank you for having me. My presentation is going to be a little bit different in that I'm very glad that y'all had experts in this field talking before me, but I am not that. Like, I am not an expert in breastfeeding. And so if I misspeak, just give me grace. Basically, I had talked with Jenna and Sarah earlier in the year, and we had an opportunity through our division to maybe support some of the work that you're wanting to do in the future. And so that's what I'm here to talk about today, is some potential collaboration that we can have. And so when Dr. Dennison was speaking, she mentioned SPAN. We love our acronyms in public health. And so what that stands for is the State Physical Activity and Nutrition Program. This is federal funding from the Centers for Disease Control and Prevention. And so South Carolina does not currently receive that funding, but our division here at DHEC is an ambassador state. So even though they didn't give us funding, we're still connected and are that state arm of the Centers for Disease Control Division of Nutrition, Physical Activity, and Obesity. And so what we were given the opportunity to do was apply for the next 5 years of funding. And that's what we did back in March of this year. And so we have not heard back yet. We're going to just play it by ear, and maybe no news is good news, who knows, but we should hear by the end of the month or the 1st of September. And so basically when we reviewed the application, there were 5 strategies that were almost prescribed by CDC, and one of those strategies was to implement policies and activities that achieve continuity of care for breastfeeding families. And so we are not the experts in that, like I said, and so we looked for who in the state are those experts, and that's how we landed with the South Carolina Breastfeeding Coalition. And so again, I did outreach to Jenna and to Sarah, and we had some conversations about what that could look like. So when we looked at the application, when they talk about the strategy of implementing policies and activities for continuity of care, these are, I wanted to just sort of be transparent and share the types of actions that CDC is looking for from states. And so this is just for your information, just for your awareness, and the links are there if you ever want more information. But from a CDC perspective, they're wanting you to use data to identify where there are gaps and needs in your state. And then what we did was we took the opportunity to identify state breastfeeding coalition, such as you, like who can provide these services, who's already providing these services, how can we connect? One of the actions was to collaborate with hospitals to look for opportunities for maternity care practices that support breastfeeding. And in addition to that, helping clinics and provider offices with breastfeeding friendly office policies. Another is around providing employers with resources and technical assistance to help them comply with the laws that y'all have heard about all today. And so those are some of the actions. The rest of them included planning and conducting a summit of key decision makers, assessing opportunities for early care and education centers to support breastfeeding. And in South Carolina, the Program for Infant and Toddler Care sort of leads that. And so that's another connection that you could possibly make. The last 2 were around improving capacity around culturally relevant breastfeeding services and supporting training to diversify the lactation workforce in South Carolina. So in talking with Sarah, where we landed and what we put in our actual application to CDC was that we would use data, and that would be our first step, is to look at the data, see where there are gaps and needs in the state, figure out how to better connect the work of DHEC's division and all the work we're doing around state level healthy eating and active living, broad implementation, and figure out how to connect with and collaborate with the South Carolina Breastfeeding Coalition, and then really honing in on employers and trying to help employers in South Carolina comply with the federal and state regulations. And so from that, then what are the proposed immediate next steps? So this is if we're awarded funding, this is sort of how we see it flowing. And so if we're awarded funding and notified, say early September, there's that weird period when you do get federal funding that you have this negotiation period with CDC. And so we would take a little bit of time to meet with all the partners that were named in our application, discuss what funding is needed, whether the action plan that we put forth needs to be revised. We'd have to go back and forth with CDC on that. And then what we have planned to do, if any of y'all have ever worked with state government, it is difficult to get money in and out sometimes, so that we have so much red tape, right? And so what we have proposed in our application is that Holspire, which is a nonprofit in our state, would serve as our fiscal administrator for the majority of our strategies. And so we'd use that first little piece of time to get all of that in place, so that then come December or January, Holspire would actually work with the South Carolina Breastfeeding Coalition to execute a funding agreement and provide funding to do the actions that we either already have in the plan or those that we've revised during that first period. And so really it would be looking like the beginning of 2024. We were very light in the things that we said we would do, because again, my division really doesn't have, this isn't an area we work in. We didn't know what y'all's capacity were. In talking to Sarah, you know, y'all are volunteer led. And so making sure that we weren't setting too high of expectations in that first year, knowing that we probably just needed to get our feet under us a little bit. And so the things we really put in that first year, which would be January through about August, September, is really, let's pull the data, let's look at it, let's make logical decisions together. And then Sarah had mentioned your community partners list, your breastfeeding friendly community partners list. Maybe revise that, update that, make sure that that is up to date and where you want it, and then develop a plan. Like, how are we going to move employers to complying with the laws? How are we going to support that in South Carolina? And so that really is what the first year looks like. And again, that could change if funded. We could change that in that first little part if that's not feasible now, but really with the overall goal of, in the 5-year period, and again, this was, I feel like setting the bar a little bit low, have 10 employers that have changed their environment to support continuity of care for breastfeeding families. So I think we could surpass that for sure in 5 years if we all work together. But that's really what we've proposed. We just wanted to be open and transparent, even though we don't know if we're funded yet. Go ahead and get this conversation started. And that's what my presentation was about today. So sort of short and sweet.
Thank you, Lori. That really does help us kind of look at it. You know, I think introduces everybody to kind of the overall sort of goal of this collaboration. Does anybody have any questions or input about that? Oh, sorry, go ahead. Was somebody else going to speak? Okay. So that's, you know, that's kind of where we are. I think we've learned a lot of sort of about the national stage, the state, and then kind of the coalition, and perhaps some ideas for what we can do, and coming up with a plan for how we move forward. I think we've got an incredible amount of opportunity in the state. We have, I think, so many folks, at least from my experience, that have a problem expressing milk at work, have a problem with that continuity of care, you know, don't know what their resources are. So we've really got a lot of work laid out for us. We also have a lot of, you know, opportunity in terms of increasing our partners in the state, so that we are, you know, kind of not just doing things all by ourselves, but really increasing the organizations we are working with. And of course, that is some important for, there we go, sorry. That's important for getting funding and moving forward. So anybody have any comments? Appreciate all our speakers today. Any questions for any of our speakers? I would love to network a little bit too. So, you know, we kind of introduced ourselves on the chat box. if everybody would like to kind of introduce them, we've got about 10 minutes. So if anybody would like to introduce themselves orally or just get to know each other, that would be great. Lori, again, thank you so much for coming and introducing yourself and what DHEC's plans are. And hopefully this grant will come through. So
yeah, we'll be in touch. And again, all that y'all have heard today and talked about and are thinking about, I think what the CDC funding, if we're funded, it'll just help you to move that forward a little bit faster. And so hopefully you see that as the opportunity that it is, and not get a little bit overwhelmed by it, because it can be a little overwhelming.
right. Yep. It sounds like a fabulous opportunity. I thought that was interesting when Dr. Dennison said that that's how they were funded. I was like, or some of the funds at least have come from there. So that's great. And it was nice to have that kind of more of an explanation of what that was. So fabulous. All tied together very nicely. So.
Hey, Sarah, this is Kat with Medela. I just wanted to introduce myself, but also share, I thought this was really interesting as it's World Breastfeeding Month, or the Breastfeeding Month and World Breastfeeding Week a couple of weeks ago. But as it relates to, supporting parents in the workplace and all these new Pump Acts and Pregnant Workers Acts, I saw an article today about, it was 6 male leadership executives from I think Covenant Health in Texas, I believe. They did a 4-day breastfeeding challenge where they had to every 3 hours sit and simulate that they were breastfeeding, try to find a place if they were on the go. And it really helped them understand and have empathy for their, lactating coworkers or employees. And I just found that really interesting, because I think it's very rare that someone can actually go through the motions of what it means to pump in your workplace and the setup, the logistics of all of it. So anyway, I can share the link in the chat, but I just thought it was kind of a cool exercise to promote awareness around breastfeeding in the workplace.
Yeah, that is fabulous. Where did you say they did it? Texas?
It was Covenant Health. So I'll send this link. There's a video, but also an article. I just thought it was so cool because, they had all these light bulb moments that I think any new mother has when they start breastfeeding and pumping and going back to work. I think it really shed a light on how they could better support, parents and, folks returning to work. So I just put it in the chat. And I guess I'll plug, we have our KIN program at Medela, which if you ever have an organization, a business, anything in South Carolina that needs help with a return to work program, Medela does a lot of that. We've worked with Nucor in South Carolina and some other companies. So we're always happy to connect and, help create better lactation spaces.
Thank you. Yeah, we definitely know that we need some better lactation spaces. How many of y'all have hear regularly that people are still pumping in cars? So anyhow, I'm going to post this link for the evaluation in the chat box. As I had said, we don't actually have SERPs for this this meeting. They changed the rules on it, and you have to get them organized quite a long time earlier. So we were not positioned to do that this time, but we will have SERPs, of course, for our conference, and for next meeting, I'm hoping that we can get it done. This one, I'm going to see if they will award them afterwards, like retrospectively. And I haven't applied for that yet, but if you would like them, just do this evaluation form. I am not sure if I left a place for the name, but if I can easily identify, like if you want to, we want the evaluations to be anonymous, but at the same time, if you want SERPs, they can't be. So put your name on there somewhere if you do want SERPs, and we will still try and get them. So, right. Thank y'all for joining. Again, I really appreciate it. and I know all of our committee does. Please reach out to all our members. I'm going to print this chat box, and then I'll have all these resources in here. We'll also have this meeting posted up in our YouTube. So if you want to go back and look at, you know, oh, what was that? Who said what in the meeting? Then it will be also on the YouTube station. So, all right.
Sarah,
Yeah. Do you have a?
just wanted to say something when you mentioned about people finding a place for them to be able to go pump. I do have a lot of people that call me and ask if they can stop in and pump along their traveling. So it is something to think about if you find that you have like a, you know, traveling nurse or whoever that's pumping and they don't know where to go besides their car. I don't know if Somerville is their, you know, spot, but at least it's an area that they could come to if they want to. And anybody here would just put them in my office.
So there's another resource we need on our map. We need like pumping rooms for, like we need like businesses for community partners who will open up their place of business for people who are like nurses or people who are traveling to pump on the go. Like,
Right.
wouldn't that be great to put on our resource sheet? Like
Yep.
in a community partner, like community partner thing, like just like you said, you could look at yourself as a resource.
Right. I've even had people who
Great idea.
missed their, like they forgot to bring parts or pieces and I have parts and pieces around. I start to put together stuff for them and just let them pump whatever it takes.
Yeah.
They even have an extra pump around if they really needed to. And I don't charge anybody. They just use it.
Right, right. And that's what we need for like the community, you know, things that could offer that would be like, you know, big institutions too, like MUSC or, you know, and there's like the mall, Tinker Mall has a spaced pump, I know, you know.
Mhm.
So a lot of the malls have something like that, but it would be good to have them listed. Like, where can you pump if you're on the go,
Right.
you know? So all the things we'd like to do.
Yeah.
Um,
One step at a time.
One step at a time. Pump Spot. How about, so is that one of it, Lynn? Is that Pump Spot where you can find that info?
Yes, as far as I know, you just add your information and then anybody, it's nationwide is last I heard, and you just put in, you know, what you're looking for and spots pop up.
I did not know that.
I didn't think it
Have
was
y'all-
local. Yeah, I didn't know.
Cool. Okay, good to know. All right. I need to figure out how to print this chat out before I close the meeting. So, great.
I saved it if you want me to email it to you, Sarah.
Oh, did you? Can you do that? That'd be awesome. Thank you, Mimi.
Okay.
All right, good. All right. Thank you all for coming. We will hopefully reconvene in October. Again, please reach out if anybody wants to help with the coalition, any of these initiatives or anything that y'all are thinking. We'd be glad to have more help, and remember those positions that are open. So, all right. I'm not going to close my screen down because I have to stop the recording and just do X, Y, and Z. So y'all are free to go when you're ready to go.
Thank you.
Okay. Thanks.
Bye.
Thanks. Bye.
Bye.
Set up. We can at least have something happening.
Do you want to stop the recording?
I want to, I do need to stop the recording. Yep. All right. Stop recording.